Hi guys, welcome to Fast Correct 21 Medical Coding YouTube channel. The purpose of the channel is to help the people who are in need of medical coding reliable resources. If you are already subscribed to our channel, help your friends to subscribe. If you are visiting for the first time, then click on subscribe button to receive latest updates in the medical coding field. The channel is helpful for freshers, experienced coders, aspirants of AAPC certification exams and AHIMA certification exams. If you have any other topics or concerns, please mention in the comment section. Please click on the like button to encourage and motivate us. Please watch until the end to gain in-depth knowledge about ICD-10 CM, CPT, EPICS coding systems. As these Q&A sessions are very useful in live coding, medical coding interviews, AAPC and AHIMA certification process. Guys, if you go to any interview or certification exams, kindly keep familiar with the code books like ICD-10 CM, CPT, EPICS, as our sessions will assist you in the process of interviews or examinations, but not an alternative to original interview process or certification exams. So in today's topic, we are going to learn about CABG coding in ICD-10 PCS and CPT. So our first question is, what are coronary arteries? So whenever we are coding a procedure, we need to know the anatomy better. If you know the anatomy, we can code properly. So what are coronary arteries? Answer: the vessels that supply the heart muscle with blood rich in oxygen. They are called the coronary arteries because they encircle the heart in the manner of a crown. So basically, whenever we find a report or wherever we find coronary means physician is talking about the heart related. So basically, coronary arteries are encircled by the heart, so they will help the heart muscles to pump properly. Next question: what is CABG? CABG means coronary artery bypass graft. So whenever there is a clot or obstruction in the coronary artery, physician will bypass that coronary artery using other arteries or veins in the human body, so they will bypass the coronary artery. So as we discussed just now, whenever we code a procedure, we need to know the indication for that particular procedure. So here, what is the indication for CABG? For example, if you have severe chest pain caused by narrowing of several arteries that supply your heart muscle, leaving the muscle short of blood during even light exercise or at rest. So if there is a narrowing in arteries, we will have chest pain. So which is the one reason for CABG. If we have more than one diseased coronary artery and the heart main pumping chamber, the left ventricle, is not functioning well. So if we have more than one diseased coronary artery means this coronary artery is already obstructed and the left ventricle is not functioning well to pump well. If your left main coronary artery is severely narrowed or blocked, this artery supplies most of the blood to the left ventricle. So whenever our left main coronary artery narrowed or blocked, we need to have CABG. And also, if you have any artery blockage that can't be treated with a procedure that involves temporarily inserting and inflating a tiny balloon to widen artery. Usually, we will call it as angioplasty. Angio means vessel and plasty means repair. So, repair of a blood vessels. So, if your left main coronary artery severely narrowed or blocked, this artery supplies most of the blood to the left ventricle. If you have any artery blockage that can't be treated with a procedure that involves temporarily inserting and inflating a tiny balloon to widen the artery, usually we will call it as angioplasty. Angioplasty means using the procedure, the physician widens the artery and he will insert the stent in the blood vessels. But if that procedure also not suitable for that condition, physician suits for patient suits for that CABG. If you have had a previous angioplasty or placement of a small wire mesh tube stent to hold the artery open that has not been successful, or you have had a stent placement but the artery has narrowed again. So here, for example, if you have a stent in from the previous surgery, so in any reason if that stent is not working properly, physician needs to do again CABG. Next one, coronary bypass surgery might also be performed in emergency situations such as heart attack, if the patient is not responding to other treatment. So wherever you go guys, surgery is the last and final option for any type of disease or condition. So it is an last opportunity to the physician to decide about the surgery. Next question, what is the purpose of CABG? CABGs are performed to revascularize the myocardium when a blockage in a coronary artery limits the blood supply to the heart. The grafts bypass the obstruction in the coronary arteries. So basically, to revascularize the vessels, we will perform CABG. What are the common veins and arteries used in CABG? Grafts can be taken from your leg, like saphenous vein, which is in your leg, and inside your chest is internal mammary artery or your arm radial artery. These three types of arteries will be useful for the coronary artery bypass grafts. What is double, triple or quadruple bypass? Based on number of grafts, we can call double means 2 grafts, triple means 3 grafts, quadruple means 4 grafts bypass. So based on the patient's condition or blocked vessels, physician will decide whether he is to perform triple vessel bypass or quadruple vessel bypass. Next question, how do you decide number of vessels to be bypassed? Answer, the number of blood vessels used will depend on how severe your coronary artery disease and how many of the coronary blood vessels have become narrowed. For example, if we have 3 vessels blocked, we need 3 grafts. Like that, it is based on the severity of the coronary artery disease to check where we need to check how many arteries are blocked and how many grafts we need to bypass those blocked arteries. What is the use of mammary artery in bypass? One of the graft vessels is usually taken from your chest as we seen in our drawing initially. So this one internal mammary artery. Surgeons prefer to use this vessel because it does not narrow over time unlike the blood vessels taken from your leg or arm. So internal mammary artery has thickened wall so that it can't create any problems in the future compared to saphenous veins as well as the radial arteries. So that reason physician will mostly prefer mammary artery to coronary artery bypass. So what is coronary circulation? Coronary circulation consists of two main arteries, right coronary artery and left coronary artery, each with several branches. So again this right and left divides into several branches. Right coronary artery usually we'll call it as RCA, divides into right marginal, right posterior descending. Otherwise we will call it as PDA. PDA means posterior descending artery. Next one, left coronary artery also divides into few branches. Here left main coronary artery usually we'll call it as LMCA. Left main coronary artery divides into left anterior descending branch, LAD, diagonal, septal, circumflex. Usually we will call it as left circumflex artery, obtuse marginal. Usually we will call it as OM. Posterior descending, posterior lateral. What is aortocoronary bypass? The aortocoronary artery bypass is the most commonly used type of CABG. It brings blood from the aorta into the obstructed coronary artery, bypassing the obstruction by means of a segment of the patient's own saphenous vein, non-autologous biological material, or occasionally a segment of the internal mammary artery. So, the aortocoronary bypass means here physician will create a bypass in between the aorta to coronary artery where it is obstructed. So here the physician will create a bypass between the aorta as well as the coronary artery near to the obstruction so that patient will get enough blood supply to the muscles. What is the difference between CABG and other bypass? Coronary artery bypass graft procedures are coded differently from other bypass procedures. In other bypass procedure codes, the body part axis identifies the body part bypassed from. However, the body part values in a CABG procedure code identifies the number of coronary arteries bypassed to, and the qualifiers specify the vessel bypassed from. For example, aortocoronary artery bypass of the left anterior descending artery and the obtuse marginal coronary artery is classified in the body part accept classification as two coronary arteries, and the qualifier specify the aorta is the body part bypassed from. So here physician has bypassed two coronary arteries, anterior descending and obtuse marginal. So here in body part axis it has two coronary arteries, and the qualifier for this is aorta is a one body part. So here body part bypassed from aorta. What are the abbreviations need to remember while coding CABG? Why means sometimes what happens, while physician report the operative procedure and he will mention only abbreviations in the operative report, he will not mention clear documentation. So while we are coding the CABG procedures, we need to know few abbreviations which are very essential in CABG coding. So we will learn those now. So left internal mammary artery, usually we will call it as LIMA. Next one, right internal mammary artery, usually we will call it as RIMA, RIMA. Next one, left anterior descending, usually we will call it as LAD. Posterior descending artery, usually we will call it as PDA. Saphenous vein graft, we will call it as SVG. Right coronary artery, usually we will call it as RCA, right coronary artery. Next question, what is op cap? Op cap means op pump CABG. What is on cap? On cap means on pump CABG. So on pump means while physician performing bypass surgery, physician will use heart lung machine, which we are going to learn down. So here, what is a heart lung machine? The heart lung machine is also called cardiopulmonary bypass machine. It takes over for the heart by replacing the heart's pumping action and by adding oxygen to the blood. So basically, whenever physician performs a bypass surgery, he will remove the blood from the heart and he will keep it in the heart lung machine, where perfusionist, the person who will trained in the heart lung machine running, is take care about that blood. So here, what is op cap means? Op pump CABG means here physician will not use heart lung machine. So what is on cap? On pump CABG means here physician will use heart lung machine for the purpose of CABG. So op cap means no heart lung machine. On cap means with heart lung machine. Now we will learn few guidelines about ICD-10 PCS CABG coding. These are not complete guidelines. So we need to familiar with our code books. How does ICD-10 PCS identifies type of tissue? ICD-10 PCS identify the type of tissue used in the CAPG in the device character 6 as autologous venous tissue means it's patient's own body's vein. Autologous arterial tissue. Autologous means patient's own body. Means physician will remove that graft from patient's own body. Auto means same, like patient's own. Autologous arterial tissue means arterial graft. Synthetic substitute means other than artery or venous. Physician may use synthetic substitute or non-autologous tissue substitute for CABG coding. So we will use to denote all these tissue types, we will use device character as 6. We will have a look on one example. If you see here, in all these three codes, sixth character is changed. Here 9, here J, here K. So first one is autologous venous tissue. Means 9 means autologous venous tissue. Here physician will use patient's own body vein. Next one J. So here physician will use synthetic substitute. Next one is K. Here physician will use non-autologous tissue substitute for bypass procedure. Next question. Does all CABG procedures involve the aorta? So far we have learned that whenever there is a obstruction or disease process in the coronary arteries, physician will bypass from aorta to the diseased coronary vessels. So here our question is, does all CABG procedures involve the aorta? Means directly blood comes from the aorta to the diseased blood vessels. So answer, not all coronary bypass procedures involve the aorta. Not all coronary bypass procedures involve the aorta. The internal mammary coronary artery bypass graft is accomplished by loosening the internal mammary artery from its normal position and using it as a conduit to bring blood from the subclavian artery to the occluded coronary artery. When coding internal mammary artery coronary artery bypass graft, the body part value identifies the number of coronary arteries bypassed to, and the qualifier specifies the vessel bypassed from, namely the internal mammary artery. Basically, in this question, here for the bypass procedure, physician not using the aorta. Here, just physician manipulating the internal mammary artery and he is bypassing the diseased coronary vessel. We will check one example here. So, bypass coronary artery, one artery from right internal mammary artery, open approach. See here, here also sixth character change. Z means one artery from right internal mammary artery. J means two arteries from left internal mammary artery with synthetic substitute open approach. Next question. Do we use other arteries for CABG? Answer. Other arteries also used to bypass an obstruction in the coronary artery. So ICD-10 PCS distinguishes these procedures by the use of different values for 7 character 7 qualifiers such as thoracic artery and abdominal artery. So what is the meaning of this is? To usually we will perform the bypass using the other than other arteries also. For example, if you use thoracic artery and abdominal artery, we need to mention in the character 7 qualifier. So for example, if you take this one O2130ZC and O2130ZF, seventh character qualifier is changing. For example, if you take seventh character qualifier as C, it is so here physician is performing using thoracic artery for CABG. Here in F series, physician is using abdominal artery for CABG procedure. Next question. How do you code if multiple coronary arteries are bypassed? When multiple coronary arteries are bypassed, a separate procedure is coded for each coronary artery that uses a different device under qualifier. For example, to perform both an internal mammary coronary artery bypass and an aortocoronary bypass at the same operative episode, when this occurs, the aortocoronary bypass and internal mammary coronary artery bypass are coded separately. Here, what happens? Physician is performing bypass using the two procedures. As we learned just now, using aorta to coronary artery, physician will perform bypass, and second procedure using internal mammary artery also physician perform CABG. So whenever this occurs like using internal mammary artery as well as aorta coronary bypass, we need to code two procedures. How do you code if an autograft is obtained from different procedure site? Answer. If an autograft means it is patient's taken it from the patient's own body. If an autograft is obtained from a different procedure site to complete the objective of the procedure, a separate procedure is coded. So what is meant by this? So if it is graft is taken from the other site not related to the procedure site, we need to code it separately. For example, when a coronary bypass with excision of saphenous vein graft done, the excision of the saphenous vein is coded separately. So why means these are not related. So these are both different procedure sites. So coronary arteries is related to the heart and vein is located in the leg. So these are different procedure sites. So we need to code both separately. An additional code should also be assigned for any use of extracorporeal circulation, continuous cardiac output during the coronary artery bypass procedure. What are the components of CABG? Procedures such as hypothermia. So hypothermia means hypothermia is usually used during cardiac surgery because it is believed to give additional protection against cardiac and cerebral ischemia, cardioplegia, intraoperative pacing, and chest tube insertions are considered to be integral to bypass surgery. So we no need to code while performing CABG along with these procedures. So these are like included in the CABG. So we can't code hypothermia, cardioplegia, intraoperative pacing, or chest tube insertion while performing CABG. Next question. What do you need to keep in mind while coding coronary artery bypass procedures? In coding coronary artery bypass procedures, it is important to keep the following points in mind. The use of a detached segment of the IMA as graft material for an aortocoronary bypass does not make the procedure an internal memory coronary artery bypass. The internal memory coronary artery bypass involves the use of IMA itself as a still vascularized conduit for the blood supply and does not involve the aorta. So what it is meant by? So detachment means like removal of IMA as a graft to make coronary artery bypass is not make the procedure an internal memory artery artery bypass. So if you want to create internal memory artery coronary artery bypass, if you want to use IMA, it is still vascularized. Means IMA needs to provide continuous blood supply to the diseased coronary artery. So when more than one coronary artery is involved in either type of graft, an internal memory coronary artery bypass or aortocoronary artery bypass graft, the anastomosis is sometimes carried out in a sequential manner, bypassing more than one artery. The mention of sequential anastomosis does not affect the code in any way. Anastomosis means joining between the two vessels. So here we have few example scenarios. Coronary artery vascularization. So you can read it to as these are self-explanatory. So here now we are going to learn about CPT CABG coding. So how do you report CABG in CPT coding? Answer: we have three options to replace CABG. If vein only, we will use 33510 to 33516. If artery only, we will use 33533 to 33536. If combined vein and artery, we will use 33517 with 33533 and 33536. So next, how do you code endoscopic harvesting of vein per CABG? To report endoscopic harvesting of a vein per coronary artery bypass procedure, we need to use 3358508 in addition to the code for the associated bypass procedure. How do you code endoscopic harvesting of upper extremity artery per COBG? To report endoscopic harvesting of an upper extremity artery for bypass procedure, we need to use 33509. So basically, whenever we have endoscopic harvesting of vein for CABG, we will use 33508. Endoscopic harvesting of upper extremity artery, we will use 33509. Basically, 33508 for vein, 33509 for artery. Next one, how do you code venous grafting only for coronary artery bypass? The following codes 33510 to 33516 are used to report coronary artery bypass procedure using vein grafts only. These codes should not be used to report the performance of coronary artery bypass procedure using arterial grafts and venous grafts during the same procedure. We need to see 33517 to 33523 and 533 to 536 for reporting combined arterial venous grafts. So basically, whenever we have a venous grafting, we need to code 5102 516 series. So whenever we have like combined artery and venous grafts we will use, then we need to code 517 to 523, 533 to 536. Here for combined venous and artery and venous, we have separate series code. So here we will not use 510 to 516 series. How do you code procurement of saphenous vein with venous grafting bypass? Procurement of the saphenous vein graft is included in the description of the work for 33510 to 33516 and should not be reported as a separate service or co-surgery. So here saphenous vein procurement is included in CABG. So in CPT we will not code separately, but PCS we will code separately. Next question. How do you report harvesting of upper extremity vein? To report harvesting of an upper extremity vein, we need to use 33500 in addition to the bypass procedure. So if we harvest upper extremity vein, we can code separately. But saphenous vein, we can't code separately. How do you code combined arterial venous grafting for coronary bypass? The following codes are used to report coronary artery bypass procedures using venous grafts and arterial grafts during the same procedure. These codes may not be used alone. So basically we will not use these codes alone. We need to use them combinedly. So to report combined arterial venous grafts, it is necessary to report two codes. The appropriate combined arterial venous graft code 335172, 33523 and the appropriate arterial graft code 33532, 33536. As we discussed just now, we can't code vein grafting whenever we perform arterial and venous graft combined procedure. Next question. How do you code procurement of saphenous vein graft with combined bypass? Answer. Procurement of the saphenous vein graft is included in the description of the work for 335172523 and should not be reported as separate service or co-surgery as we learned previously. How do you report arterial grafting for coronary artery bypass? To report only arterial, if the physician uses only arterial graft, we need to use 33533 33536 series. So next question, when do you code graft material separately? 35500 upper extremity vein, 35600 upper extremity artery, 35572 femoropopliteal vein segment. So basically, whenever physician will take, procure or harvesting these veins and upper extremity vein, upper extremity artery or femoropopliteal vein for the coronary artery bypass graft, we need to code them separately. So for example, we have few examples here. Using these examples, we will learn properly. So here CABG times 2. I2 coronary bypass graft using the saphenous vein to bypass the right coronary artery and the left anterior descending artery. So here physician is performing bypass from direct aorta to the coronary artery bypass graft using here physician using saphenous vein. So here we need to code vein only. So how many arteries he is bypassing? Two arteries, right coronary artery and left anterior descending artery. So using two saphenous vein, physician is performing two coronary artery bypass surgery. So our code is here 33511 CABG vein only, two coronary venous grafts. So if you check it in the CPT book, here physician has used saphenous vein for, here he has used only vein, saphenous vein, and how many veins he has used? Two coronary venous graft, like two saphenous vein. So we need to code 33511. So basically number of veins or arteries harvested for bypass we need to code. Here physician has harvested two saphenous vein. So we need to code two coronary venous grafts. Next question, CABG times 2. Aorto coronary bypass graft using the internal mammary artery to bypass the right coronary artery and the left anterior descending artery. Report code 33534 CABG artery only, two coronary artery grafts. So why means here physician has used internal mammary artery to bypass the right coronary artery and the left anterior descending artery. So here physician has used only artery. So we need to code here 33534, which denotes two arteries physician has used. So next one is CABG times 3. So aortocoronary bypass graft using the saphenous vein to bypass the right coronary artery and the left circumflex artery, and using the left internal mammary artery to bypass the left anterior descending artery. Report code 33533. So basically this is a procedure. Here combined artery and vein bypass graft is performed by the physician. As here physician has performed one saphenous vein to two arteries, means he has used two saphenous veins to bypass right coronary artery and left circumflex artery. And next section he has used left internal mammary artery to bypass the left anterior descending artery. So here physician used vein as well as artery for performing coronary CABG procedure. As we discussed now, just now, so to code combined artery and vein, we have 33533 series. Here artery only single artery graft also use. This is the add-on code 33518. CABG combined vein and artery graft, two venous graft for saphenous vein. So here physician has used two. So 33533 is for artery only. 33518 for combined vein and artery graft. So basically whenever we have a combined artery and vein graft, we can code artery from the artery section. For vein, we need to code combined vein and artery section, which is 33517 series. Thank you guys. Hope you understand this section. If you have any comments or anything, just keep it in the comment section. Please like, subscribe, share and comment. Any suggestions, please mail at fastcoder21@gmail.com. Thanks for watching Fastcoder21 Medical Coding YouTube channel, guys.